Doing cutting-edge research at PNI to move the field forward and improve the standard of care for all the diseases that we see. Autoimmune neurological disorders are rare, but when you put them all together, there are quite a number of patients that have these disorders. Autoimmune neurological disorders occur up to 10% of the general population and can involve the central or peripheral nervous system.
Just been in pretty good health all my life until a couple of years ago. You get shocked by something that happens that you don't understand. So.
Doctors had told me that there was nothing that could be done, that all I could do was kind of stay home and rest and take pain medication and live my life that way. But fortunately, I didn't take that for the answer.
One of the scary things about the brain is any little thing, whether it's a little stroke or inflammation, causes tremendous symptoms, and it's very scary. When you have inflammation in the brain does not tolerate it. Many of these disorders, because they're so rare, people either don't understand what they're actually dealing with, or when they do the simple things, they sort of give up on the patient.
They just looked at the same things they had been. They looked at the typical things. Autoimmune is not well understood at all. I know that if there's a problem, there's always a solution.
There have been a lot of development of new drugs over the past few years that are more specific, more powerful. One of the things that we're trying to do is incorporate that new knowledge to treat our patients. Because we're focused on the research side of discovering new antibodies in these patients, we are able to understand the situation, assess it, and go and give the treatments that are necessary in order to help the patient achieve neurological recovery. We've had a few cases of paraneoplastic syndromes where we tested the commercial antibody testing and they were negative. But I knew the patient had the disease, whether they had one cancer or another. And we treated the patient as such, even though the testing was negative. And we saved the blood and the spinal fluid. And 5 years later, we were able to use the developing technologies in the lab and identify new antibodies that we published in Nature Biotechnology a few years ago.
I just know when he says something's going to happen around here, it does. I mean, the staff jumps, and that's what you need.
With Dr. Kesari, found new hope and new treatments that have really changed my life and given me life and hope for a really good future, a future that I'm looking forward to.
And that's really the opportunity at PNI, is to change what we do now. Move the field forward and improve the standard of care for all the diseases that we see.